Welcome to EPG Pathshala. I am Professor Dr. Komal Chauhan, working in the Department of Foods and Nutrition. Just now I am also a coordinator of dietetic stream in the department, coordinator of Nutrition Counseling Center in the department, and also associate director for Food Service Management, which is a postgraduate diploma course run under the higher payment program of the university. I work in the Institute of Faculty of Family and Community Sciences under the umbrella of the Maharaja Sayajirao University of Baroda. Today, we are going to deliberate on the most vulnerable yet respectable and experienced group of the society, elderly, also well known by geriatrics in scientific community. I call them as people who live long. People don't grow old. When they stop growing, they become old. Elderly should remain fit, healthy, with proper nutrition to fit against obstacles in life. Aging can be defined as multi-dimensional process of physical, psychological and social change. The senior citizen comprises of those above 60 years of age in some countries and above 65 years of age in other countries. Aging is also defined as regression of physiological functions accompanied by advancement of age, and it also refers to normal, progressive and irreversible biological changes that occur over an individual's lifespan. It is also defined as survival of a growing number of people completing their traditional adult roles. If we look at demographic transition in the world, it has been characterized by considerable increase in the absolute and relative number of elderly people. This has been especially true in case of developing countries like India, where aging is occurring more rapidly due to decline in the fertility rates combined by increase in life expectancy of people achieved through the medical intervention. About 60% of elderly live in developing world, and this will rise to 70%. Day by day, the number is increasing and increasing. Most of its growth will take place in developing countries, and over half of this will be in Asia and mainly again in India. A fundamental challenge is to understand how centenarians live longer and what specific biological, psychological and sociological characteristics they possess that would allow them to survive, live longer. Studies on mortality profile of elderly shows that proportion of people with chronic diseases has risen decade by decade after 60 years and on. Let us see why demand of good nutrition and fitness is required in elderly. The growing number of older adults pose increased demands on the public health system and on medical and social services too. On one side, older people consume higher proportion of the national budget and social security. This becomes somewhat self-evident aspects also. However, on other side, elderly people contribute greatly to the family environment, enriching the essence and spirit of existence, and should be considered as an asset to the community. So, in the absence of caretakers, they should be self-sufficient to take care of their own health. Eating healthy combined with regular physical activity is important at an age and can help to a person live a full active life and preserve their independence into older age. Regular exercise can also help boost energy levels, manage symptoms of illness or pain, reduce stress, and it's also good for your mind, mood and memory. It has been increasingly realized that diet plays a vital role in aging process. Certain types of foods can accelerate the aging process, during which diet related degenerative diseases are superposed. On the other hand, there are specific foods and nutrients with activities providing fitness which can slow down the aging process, prevent onset of diet related chronic degenerative diseases, thereby ensuring healthy aging. However, certain diseases are caused purely due to nutrient deficiency or overnutrition also. Defining the specific nutritional needs of an older person is a very important task. Older persons are particularly vulnerable to malnutrition. Moreover, attempts to provide them with adequate nutrition encounter many practical problems. First, their nutritional requirements are not well defined, since both lean body mass as well as basal metabolic rate decline with age, approximately 3 to 4% per decade, and older persons' energy requirement per kilogram of body weight is also reduced. Nutrition is an important aspect of healthful behavior and major components of general well-being of individual throughout their life cycle, and is an important factor contributing to aging. Older adults, which are considered to be 65 years of age and over, continue to be identified as a subgroup of the population at significant risk of poor nutrition as compared with younger adults, and there is significant potential for nutrition to influence the survival in this age group. It has been shown that loneliness, social and physical health are directly related to dietary adequacy and well-being of elderly. So, therefore, let us see the role of nutrition in healthy diet that plays a very important role in promoting and maintaining health of an elderly. Good nutrition helps in preventing or delaying the onset of age-related illnesses. A good diet in later years helps in reducing the risk of these diseases and in managing the diseases, signs and symptoms, as well as that contribute to a higher quality of life, enabling older people to maintain their independence by continuing to perform their daily activities. There are so many nutrients, and there are certain nutrients which are very important for good health and maintenance. They include fibers. Fibers are eating habits of foods which help our bowels move regularly, lowering the risk of constipation. A high fiber diet can also lower your risk for many chronic diseases including heart disease, obesity and some cancers. Good source of fiber include whole grain breads, cereals, fruits and vegetables, pulses such as beans, peas, lentils. Calcium and vitamin. Vitamin D especially, older adults need extra calcium and D vitamin to help maintain bone health. Being a healthy weight can help to have a strong bone. Take 3 servings of vitamin D fortified milk, cheese or yogurt each day. Other calcium rich foods include fortified cereals, dark green leafy vegetables and fish and soft bones. Also, iron and vitamin B12 is important. It is responsible for carrying oxygen around the body. With vitamin B12 also keeps your brain and nerve system healthy. Red meat is an important source of iron, while fortified cereals, lean meat and some fish and seafood are source of iron and vitamin B both. Taking vitamin C rich food in consideration, orange juice at meal time can help your body absorb iron along with folate or folic acid. You may also have heard of folate. Too little of this essential vitamin B is known for contributing to anemia and increasing the risk of central nervous system defect. Older people encounter this deficiency for so many reasons, and the most vulnerable meet is said to be consequences which are leading to miserable life of both elderly themselves as well as their caregivers. There are also certain advantages of having good nutrition status, obviously. Let us look at those. Helping our elderly manage their diet and eating habits with proper and appropriate nutrition can offer them numerous health and quality life benefits, including increased cognition functions, resistance to illness, higher energy levels, improved immune system, faster recuperation times and better management of chronic health issues. Side by side, let us also review some considerations for normal diet of elderly. With biological aging process, there are associations with physiological changes in the body, changes in food preferences and food and nutrition intake as well. With aging process, there are several changes which affect the diet of an elderly. Reduced metabolism, loss of teeth, difficulty in mastication, alteration in taste buds, gastric dysfunctions and reduced intestinal mobility are such changes. There are several studies which have shown that in India, to assess dietary intake and nutritional status of an elderly living under different situation, and most of the studies also show that socio-demographic situations have great bearing on nutritional and health status of an elderly. Outcome of all studies conducted is that there appears a gross dietary inadequacies in terms of energy, calcium, iron, beta carotene and other important nutrients in free living elderly population, as well as it is seen in institutionalized elderly. There are some suggestions for the elderly caregivers also. Plenty of water or fluid intake needs to be included in the diet of the elderly. Mainly more than 6 glasses in winters and 8 glasses in summer. 4 to 5 meals per day are appropriate. Fixed timings of meals may be maintained. Ensure adequate consumption of dairy products, protective foods like fruits and vegetables and cereals in the diet. Include whole grain, cereal, sprouts, fiber rich foods in the diet. Avoid dry meals. Always add some beverages in the menu. Skipping of meals should be avoided. Special needs for the elderly in disease conditions like hypertension, diabetes may be considered. Encourage the elderly member to eat with other members of the family. Include plenty of salad, soup and juicy fruits in the diet. There are specific piece of specific foods in the plate. may be maintained for serving very old elderly and especially elderly with poor eyesight. Avoid heavy meals and late night dinners. As a general guideline, adequate consumption of fruits and vegetable, whole grain, dairy products may be included in the diet of elderly, whereas white poison foods like ghee, sugar, salt and oils can be controlled depending upon the physical condition. For diabetic patients, apart from increased physical activity and maintenance of ideal body weight, carbohydrates such as sugar and starchy foods like potato and rice may be restricted and higher fiber rich food should be adequately provided. For hypertensive patients, intake of fats, saturated fat may be restricted, ghee, coconut oil and butter. Salt intake should be maintained and checked. Certain high amount of salt rich food should be avoided. Physical activity and maintenance of desirable body weight is must. Egg, red meat, alcohol, smoking is to be avoided and elderly should not go for it. As revealed by studies, elderly population nutritional status is deteriorating day by day. Treating elderly, especially with dental problems, is very important. However, it was also seen that there was highly significant decline in taste sensitivity with advancing age, and addiction with tobacco and smoking decreased the status. It is recommended that oral problem of elderly should be attained immediately to avoid health complications. Generally, edentulous elderly patients may be given bland soft gruels full of energy, carbohydrates and proteins, as well as sufficiently enriched foods like with minerals and vitamins. Soft cooked foods may be included. Sprouting and fermentation process causes ease in digestion of the food, so that can be encouraged. Cooking practices which ease the digestion help in producing more saliva and facilitate mastication and swallowing to the elderly. Use of cutlery should be discreet to the elderly's essentials. It should not hurt the mouth cavity of the elderly. Thus, soft and bland cooked food, mashed or blenderized food and fruits should be the basic item in the diet of elderly with oral cavity problem. Now, let us understand role of fitness and exercise amongst aged people. Physical activity contributes to healthy living to a greater extent. In Russia, labor is believed to be a major cause of longevity. The World Health Organization have advocated for the promotion of participating in regular moderate intensity exercise for being in a youth condition into a older age. Physical activity protect many aging people from depression and problems that affect the mortality and morbidity of the elderly population. High walking speed to daily life is a significant predictor for prolonged active expectancy of the elderly. High intensity resistance exercises is a feasible and effective means of counteracting muscle weakness and physical fragility in very old elderly. Exercise training may produce greater improvement in elderly with physical and emotional impairments. When determinants of leisure time physical activity and in rural as well as urban middle-aged older women were studied, it was found that rural women and who were less educated were more sedentary than urban women. Rural women reported more personal barriers to such type of activity and cited giving duties as their top barrier. Compared to that, lack of time was the cause for urban women and had greater body mass indices found among them. Rural elderly women were less likely to report sidewalks, street, high crimes and become a facilitator to the people. Physical activity were less likely to develop cognitive decline as well. Studies shows that impact of long-term moderate physical activity on functional performance, bone mineral density and fracture incidence in rural elderly women, and they concluded that elderly women who continued doing such activity and programs sustain fewer fracture and have better muscle strength, balance, gait and health rating women in general. According to WHO, over a lifetime, women lost about 40% of their skeletal calcium, approximately 1/2 in the first 5 years after menopause and the remaining at the slower rate thereafter due to hormonal imbalance with sedentary lifestyle. Let us review advantages. Exercise helps older adults to maintain or lose weight. Exercise enhances mobility, flexibility and balance. Exercise improves your sleep. Exercise boosts mood and self-confidence. Exercise is also good for a brain, benefit regular brain function and can keep brain active. Let us see the guidelines for elderly which are very important. Older adults who are aged 65 and very old are generally in and have no health conditions that limit their mobility, should try to be active daily and should also continue to do 150 minutes of exercise in a week's time. Moderate intensive aerobic activity such as cycling or fast walking every week and muscle strengthening exercise or activities on 2 or more days in a week that work all major muscle group like hips, back, abdomen, chest, shoulders, etc. You can go for 75 minutes or 1 hour exercise or a vigorous intensive aerobic activity also such as running, playing game, singles or in doubles or in group which will give muscle strengthening activity and at least for 2 days in a week. Muscle groups like legs, hips, back, abdomen, chest, shoulder and arms are getting relaxed here. This is also recommended by WHO under their physical activity guideline for elderly. Let us see factors affecting adverse effect. Nutritional risk factors such as dependent on food related activity of daily living like shopping, cooking, eating are well influenced on seniors' access and consumption of food, potentially influencing also their health and survival. These risk factors are specific to this age group and frequently not considered. Therefore, nutrition parameters in population based studies for younger group is important. Interrelationship between physical and psychological problems give a rise in functional impairment and most prevalent is poor bone health. Apart from these, elderly also face frequent episodes of infections and acute illnesses, which results in many disturbances or imbalances in them. Existing knowledge about nutrition and aging suggests that as age increases, food and energy intake also decreases in elderly because of malabsorption, decline in senses of smell, taste, chewing problems and so on. Some of the other leading causes of poor health are eating alone, taking multiple medications and having an illness, lack of healthy staple food availability, physical disability, family system which is not at place, the status of elderly lower or more imbalances. Due to all these factors, food related activities and unwanted problems arises. This become economically inactive and dependent on others. As a result, they lose their capacity and self-confidence and their physical and mental health gets deteriorated. The general healthcare system in India itself is very inadequate. The other younger age group attract and demand greater attention, resulting in devaluation of elderly's healthcare. In education system also, children are more targeted and taught about healthcare practices of young age groups, but not emphasis on being told about elderly's healthcare. Simultaneously, neither media nor curriculum focuses on giving proper healthcare facilities to the elderly. As a result, their health deteriorates as lot of ignorance is prevalent regarding the health of elderly. Thus, it can be concluded that antioxidant rich foods which are lower in calorie, balanced diet, regular meal consumption, moderate level of physical activity and involvement of others in the activity or medication, yoga, some of the other holistic approaches lead to good health among older aged people. Following points are the summary or the salient secrets which help in climbing the ladder of aging. Consumption of antioxidants, that is B vitamin and calcium as well. Amount of elderly leading to their low in morbidity profile, showing physical and mental fitnesses. Food technologies also has helped, like amylase rich food and fermentation may help the elderly with oral cavity problems or swallowing problems. Regular consumption of various meals maintaining good nutrition status leading to proactive effect on physical and mental health of the elderly is important. Active participation to various daily living activities of the elderly helps in keeping them away from ill health, fit and alert. Yoga, meditation, religious activities help elderly to maintain spiritual and physical health. Their engagement in activities require mental efforts and are must for stress-free life. Health and disease condition and biochemical abnormalities may be taken into account while planning the diet. Weight should be maintained, monitored within permissible ranges, and elderly should be encouraged to undergo or also have medical checkup yearly or as required to avoid nutritional problems. Minor health complaints, disease may decrease, mental impairment may improve with improvement in the nutritional status of health and fitness. Okay then, let us summarize the topic of interest, which is unforgettable memories, situation that everyone will go at one point of time. We gain knowledge on several nutrients and their importance that provide nutrition through proper guideline on diet and its role in effective, healthy, long living life. We also try to learn the holistic approach like alternative health system that has a role in health and fitness on the elderly. Wish you all a healthy and happy aging. Thank you. Namaste.